really struck me is that our life expectancy in Indiana has declined in recent years, specifically among those who are front and center to our future, working-aged adults between 25 and 64 years old.
Well, today we hear about his plan to get Hoosiers' health back on track.
WRTV's Meredith Hackler spoke to the governor and Indiana's top doctor about this issue.
Indiana is one of the most unhealthy states in the country. Governor Eric Holcomb wants to invest $240 million into public health across the state. He and the Department of Health say that would allow local health departments like here in Marion County to tailor programming to their needs.
When it comes to public health, we're really dealing a lot with the opioid crisis and also just keeping on top of the demands of Marion County. Obviously, we're the largest in the state, and while we have the most robust local health department, it's also incredibly challenging just to keep up.
Marion County isn't the only county struggling to keep up. Health departments across the state have a hard time meeting the demands of the communities they serve. And the state says it comes down to funding.
If you were to think about all 50 states as a car out on the racetrack, ranking 46th or 47th or 49th, we'd be in the 16th or 17th row if every state had a ranking.
According to the state, Indiana is 45th in the country for state government public health funding, and that has a trickle-down effect. The state of Indiana has a rising death rate from drugs, alcohol, and suicide, rising rates of obesity, and a high smoking and vaping rate. The state says data proves that more funding will help curb these health issues.
Currently, because people have to have many hats, we have 1 or 2 employees in some health departments, they have to kind of be the jack of all trades, and they're not the master of anything sometimes.
We are here to support public health.
As a way of encouraging the General Assembly to go along with Governor Holcomb's funding plan, public health professionals from across the state came to the State House to show their support. This investment is something the governor says the state can afford.
This is not a one-size-fits-all. This is not a mandate or worse, unfunded mandate. This is the state coming in to say, how can we, I'm not going to go Jerry Maguire on you, but how can we help you improve?
Working for you at the State House, Meredith Hackler, WRTV.
I checked with the Indiana Department of Health website today to find out what is readily available to address your health. And some programs include Baby and Me Tobacco Free. That's a program helping pregnant women and new moms quit smoking. If you want to quit smoking, the state health department also links you to a Quit Now Indiana program. That's a free cessation program for anyone. Women, Infants, and Children improves access to nutritious foods and promotes healthier eating and lifestyles. Currently, the WIC program serves 145,000 Hoosier women, babies, and children. There are eligibility requirements. And there is a list of resources for people living in rural areas, connecting you to primary care services, heart health initiatives, and programs focused on respiratory health. All of this is at your fingertips right now at the Indiana Department of Health website.
The FDA and independent experts are discussing a potential new COVID-19 vaccine strategy. The proposal would have Americans getting 1 COVID shot every year, much like the flu vaccine. ABC News reports vaccine experts and the FDA held a meeting today to discuss the plan. Those in favor of 1 yearly shot hope it makes the guidance easier for people to understand, which could potentially increase vaccination rates. A decision is not expected tonight. This process could take a few weeks or even months.